Hi, hello everyone. Welcome to Dr. Ravichandra official. In this video, we will discuss intracellular accumulations. Intracellular accumulations comes under three categories. One is normal cellular constituents can be accumulated, or abnormal substances can be accumulated, or pigments can be deposited within the cell. Under the normal cellular constituents, lipids, proteins, and carbohydrates accumulation comes. And abnormal substances can be exogenous or endogenous. Pigments are also exogenous or endogenous. We will discuss one by one. So, pathogenesis of intracellular accumulations. Normal substances, if they are produced in excess or if rate of metabolism is inadequate to remove it, then there will be accumulation of that constituents. So, example, fatty liver. Next, abnormal or normal substances accumulate due to genetic defects in the metabolism or packing or transport. Example, all the storage diseases. Abnormal exogenous substances accumulated. Example, carbon particles or silica. Lipid accumulations. Triglycerides, cholesterol esters, and phospholipids can deposit or accumulate within the cell. Abnormal accumulations of triglycerides in parenchymal cells is steatosis or fatty change. It is seen in liver, heart, muscle, and kidneys. Etiology includes toxins, protein energy malnutrition, diabetes mellitus, obesity, and anoxia. Fatty liver. It is the most common condition seen in liver, and the most common cause for fatty liver is alcohol abuse. The free fatty acids esterified in liver to triglycerides and converted into cholesterol or phospholipids or oxidized to ketone bodies. Triglycerides plus apoproteins will result in lipoproteins. Fatty liver occurs because of three mechanisms. One is increased uptake of the fatty acids, second, decreased catabolism of triglycerides, and the third is decreased secretion of lipoproteins. So, increased fatty acids uptake or decreased triglycerides catabolism or lipoprotein secretion decrease result in fatty liver. So, in a normal cell, because of the abnormal metabolism, all the hepatocytes will go into a condition called as fatty change or fat accumulation of the fats resulting in fatty liver. So up to this is a reversible cell injury. So when alcohol intake is s- stopped, it may revert back to normal. If alcohol intake is continued, the patient may go into a alcoholic liver cirrhosis and then alcoholic liver disease, which are irreversible. Increased size of the liver and it becomes bright yellow, soft, greasy. Weighs around 3 to 6 kgs. There will be membrane bound inclusions in the endoplasmic reticulum. Initially, small vacuoles in the cytoplasm around the nucleus will form. Later, these vacuoles coalesce, creating a cleared space that displaces the nucleus to the periphery. Fatty globules fuse to form fatty cysts finally. So this is a beautiful picture showing the fatty liver condition. First picture is normal liver Later, because of the accumulation of the fat, the adipocytes will take up the fat and thereby become swollen, and the nucleus will be pushed to the periphery. Later, these fat cells will fuse to form fatty cyst. Morphology: fatty change appears as clear vacuoles. So, whenever under microscopy, if you see a clear vacuole, it may be because of the fat or water or glycogen. So, frozen sections are used for fat staining. Sudan 4 and oil red O are the special stains that are used to stain the fat. And PAS or per iodic acid skiff is used to stain glycogen. By doing this staining on the sections, you can clearly demarcate the fat accumulation. So this is a microscopic picture. By seeing under the 10x also, you can say all the cells are looking clear vacuolated cytoplasm, nucleus pushing to periphery. So it is a fatty change. This is one more picture showing fatty liver. Now coming to deposition of fats in the heart. It creates grossly apparent bands of yellow colored myocardium alternating with bands of darker red brown uninvolved myocardium, and this effect is called as Tigard effect or Tigard effect. In the MCQs, this question can be asked, or for 3 marks also, you can get Tigard effect. So it is seen in fatty change in heart is Tigard effect. Because of that, grossly apparent bands of yellow colored myocardium alternating with darker red brown bands of uninvolved myocardium is called as Tigard effect. Cholesterol and cholesterol esters can also be accumulated within a cell, and the conditions are atherosclerosis, xanthomas, and cholesterolosis. So this is a gross picture showing atherosclerosis, and under the microscopy you can observe the deposition of the cholesterol and cholesterol esters. This is a picture showing cholesterolosis, accumulated cytoplasms. Now coming to proteins accumulation. Reabsorption droplets in proximal renal tubules seen in nephrotic syndrome. They are pink hyaline droplets in the cytoplasm of a tubular cell. Plasma cells will secrete immunoglobulins and are called as Russell's bodies. These Russell bodies are homogeneous eosinophilic inclusions that are distending the endoplasmic reticulum. Defects in protein folding is maintained by chaperones. So they will see that protein folding should not be misfolded. There should not be any defect. So chaperones will align the protein folding, and a defective transport will result in hypercholesterolemia because of the alpha 1 antitrypsin deficiency. This is a beautiful picture showing protein deposition in the nephrotic syndrome. And this is a beautiful picture showing the liver in a alpha 1 antitrypsin deficiency patient. So proteins may undergo mutations, thereby normal folding of proteins will not occur and transport will not occur. Misfolding of misfolded proteins may form because of the problem in the chaperones. And because of the lack of the enzyme also, these proteins are misfolded. So this is a picture showing Chaperons are nothing but heat shock proteins, HSP70, HSP60. These will help in forming a protein folds, mature folded proteins. These chaperones can be mitochondrial or secondary chaperones may be also be seen. Remember, chaperones are nothing but heat shock proteins, HSP 70 and 60, helpful in folding of proteins. With their defect, there will be misfolded proteins formation and accumulation within the cell. So, there will be conditions like ultraviolet radiation, heat, free radical injuries, etc., that will cause stress. As a result of this, proteins may result in misfolded proteins, non-functional proteins, and aggregates, which may result in death. So, chaperones, heat shock proteins, with the help of ubiquitin proteasome pathway, they will remove the misfolded proteins by degrading them into peptide fragments. Classical example for abnormal protein foldings or misfoldings is neurofibrillary tangles, which are characteristic features of Alzheimer's disease. So the arrow is indicating the abnormal folds or neurofibrillary tangles. This is a picture showing the amyloid deposition. Amyloid is nothing but a proteinaceous substance. Now coming to pigments. Pigments can be exogenous pigments or endogenous pigments. So exogenous pigments, carbon or coal dust deposition is called as anthracosis. Anthracosis lung. And the blackening is due to this pigment, carbon or coal dust. It is also called as anthracotic pigment. It is also seen in coal workers' pneumoconiosis. Next, exogenous pigment is tattooing. Pigment phagocytes dosed by dermal macrophages which retained for lifelong. Coming to endogenous pigments, lipofuscin, lipochrome or wear and tear pigment or aging pigment. Melanin, it is a brown black pigment. Homogentisic acid defect will cause passage of black colored urine called as alkaptonuria, and the process is called as achronosis. Hemosiderin pigment will be golden brown color, and deposition of hemosiderin pigment will cause hemosiderosis. This is a picture showing the anthracosis. All the black colored deposits that you are being observed is anthracotic pigment, coal dust. This is a gross picture showing anthracotic pigment in a lung. Lipofuscin or wear and tear pigment or lipochrome pigment or aging pigment. This is one more picture showing the brown colored arrow. Arrow is indicating the lipofuscin pigment. Hemosiderin is also deposited within the cell, resulting in hemosiderosis that can be stained with a pearl's Prussian blue stain. And this is hemosiderin pigment, brown colored all. And hemosiderin can be differentiated using a special stain called as Prussian blue or Pell's blue reaction. Now coming to bilirubin accumulation. Normal major pigment found in bile is bilirubin. It is derived from the hemoglobin and it contains no iron. Excess of this bilirubin pigment within the cells and tissue will result in jaundice. This is a classical picture showing the bilirubin accumulation. All yellowish discoloration of palpebral conjunctiva. Under the microscope, the bilirubin pigment is seen like this. Thank you for patient listening. With this, our intracellular accumulations topic is completed. Like, share, and subscribe Dr. Ravichandra official for more videos.